Good afternoon. Thank you all for coming. Just to take care of a little bit of housekeeping, if you're on Zoom, please mute yourselves. And the restrooms, if anybody needs to go, is out the door and either way, but all the way around. It's like on the other side of this wall. Okay? So thank you all for being here. This is our first in-person gathering in over 3 years. Welcome to the celebration of the completion of the Ascension Mercy Crisis Stabilization Unit. My name is Jackie Baker. I'm from Christ the Lord Lutheran Church, which is a proud member of the Fox River Valley Initiative. And I am a co-chair of this meeting. Bill?
Thank you, Jackie. I'm Bill Kale. I'm from the Unitarian Universalist Society of Geneva, also a proud member of the Fox River Valley Initiative. Our first speaker today is going to be the Reverend Dr. Amy Peeler of another member organization, St. Mark's Episcopal Church of Geneva, and she'll be followed by the Reverend Michelle Huang of the Fox Valley Presbyterian Church. Reverend Peeler, please.
What a joy to be with you in person. My first time to be here in person rather than on Zoom, as I'm a relatively new member. Well, let's open our time together in prayer. God, we are so grateful for the work that has gone into the realization of this Crisis Stabilization Unit. For the institutions which have been a part, the individuals here at the hospital, and part of the Fox River Valley Initiative, all the work and the steps and the patience and the endurance. We are grateful for this day. We entrust this space to your providential care and ask those who are employed here who will meet needs that they will have wisdom and discernment, eyes to see the humanity of those who come in, and that the work that is done here will make a good difference in the lives of those who come, that harm would be prevented and good would begin. We ask all of these things and trusting your providential care and pray in your name. Amen.
Amen. Amen.
My name is Michelle Huang, and I'm one of the pastors at Fox Valley Presbyterian Church, a proud member or institution of Fox River Valley Initiative. Today, we are here to celebrate how democracy is in action can lead to solutions for communities. Our work as Fox River Valley Initiative is about addressing problems with results and being active in our democracy and not merely spectators. We are active, nonpartisan organizations united to make the world as it should be, united for the common good, which is hard to find in today's divisive climate. And we are here to look to the future and expand on the work we've done so far. Imagine what kind of change we can create if 2,000 of us gathered on July 17th with key power people such as the governor or US Senator. This is democracy in action. It is our right as citizens of this country. We don't just ask our elected officials to deliver, we have to deliver. And we do so by bringing people together with well-researched solutions. When you show up, even better, when you bring 10 or maybe even 25 people to a meeting like this, you show elected officials that these issues are important. Thank you for being part of another step toward our greater vision of making the world as it should be. And join us on July 17th at the House of Hope in Chicago and show our elected officials how active citizens can bring about a better, just community.
So what is a Crisis Stabilization Unit? Rick, could you come up and let us know? And then after that, Ann will come up to let us know how this Crisis Stabilization Unit came about.
Thank you, Jackie. I'm Rick Lathrop, a member of the Congregational Church of Batavia and the Fox River Valley Initiative. I'm wearing this orange shirt because Thursday was National Gun Violence Awareness Day. Unfortunately, we've made every day in this country National Gun Violence Awareness Day. We can't get away from it. One of the things that this organization is also working on is a way to try to reduce gun violence. So that's why we're wearing orange. We've done this every year for 3 or 4 years, and we'll do it again next year. A Crisis Stabilization Unit is an emergency room for people who are having a mental health crisis. It will be staffed by trained mental health workers. It will be available 24/7. And it's better than, in our view, and in a lot of views, the hospital emergency department. Because a person with anxiety reaction can go to an emergency room and sit for 4 or 5 or 6 hours because they're triaged. Naturally, they take all the car victims, accident victims, and all those people first. So Crisis Stabilization Unit will deliver medical services in a 24-hour period to people who are having a mental health crisis. It's open to individuals. If I'm in a crisis and I know it, I can walk in there and say, I need some help. If my family sees I'm in a crisis, they can take me to the Crisis Stabilization Unit and say, Rick really needs 24 hours to cool off. He's not taking his medicine anymore. Would you get him back on his medicine and send him home? Also, unfortunately, some people with mental health crises get involved with the police. Police can also bring people to the Crisis Stabilization Unit. One of the things that is very attractive to some of the law enforcement officers is the fact that they walk in the door, they introduce the person to the staff, they stand around for 5 or 10 minutes to make sure everything is calm, and then the police officer goes back to work. As compared to the emergency room where sometimes the police officer has been required to sit there. The next thing is Crisis Stabilization Unit will do so much to reduce the cost of mental health care in our county. Emergency room care is the most expensive health care we can find. With the Crisis Stabilization Unit, they can take care of people with a mental health crisis with mental health treatment at a much, much lower cost. It also costs a lot more to house somebody in our county jail than it does to bring them to a Crisis Stabilization Unit. The last thing I'll share with you is some people become reluctant to check themselves into a behavioral health facility a second time. The first time they don't know any better. So they check themselves in, they get help. Sometimes they are required to stay there for 5 or 6 or 10 days. As a result, the second time they need that kind of assistance, they will be reluctant to do that. Crisis Stabilization Unit, 24 hours, time to relax, time to get away from the stresses that are causing the mental health crisis, time to get back on the medications, and then either go home or be referred for further care. So that's what a Crisis Stabilization Unit is. And speaking as one of the leaders of the Fox River Valley Initiative, I am so appreciative that Ascension, Mercy, and Aurora has become the leader in King County. Thank you.
And I, like Rick, I'm Ann Alexander, member of the Congregational Church in Batavia and member of Fox River Valley Initiative. Now, the history of how this came about, FRVI had wanted a crisis stabilization unit in the area since at least 2017. Early research included a visit to Rosencrantz, and I just remember, I can take this up. Rosencrantz in Rockford with at that point Sheriff Don Kramer and Joe McMahon, the state's attorney. Rosencrantz was a successful CSU until Governor Rauner slashed the Medicare reimbursement rate. So it closed. They also had Judge Leafman come up from Dade County, Florida. This was a pioneer in the CSU concept and a great advocate and source of expertise. Obviously, for any CSU to survive, that reimbursement rate had to be fixed. So FRVI and other Metro AIF groups met with Governor Pritzker, and the daily rate was raised from $80 to $800. About this time, Michael Brown of President's Mercy reached out to FRVI to help him get a CSU right over there at President's Mercy. It was a good location. Mercy had always had a component of mental health care. And they had a surgical space that was empty. It could be rather dramatically converted for about $1 million. 3 anonymous donors came forward and offered $450,000 under the proviso that the hospital, the foundation, gathering other donations, would at least match that amount. And the whole project had to be approved, ready for construction within 3 years. They had to know that it was going to come about before giving money. So the clock was ticking. Despite inquiries, we didn't hear anything for a while. As it turns out, President's Mercy had become Amita Mercy, and Mike Brown was replaced by the new president and CEO, Richard Rohr. Rich met with us to say the plans had been totally revisited, and they realized, no, this needed a new design, more state of the art, and it was going to be on a much larger scale, including several other departments. They also had Dr. Berkowitz, a well-known psychiatrist with CSU experience. He was now on the staff. He was going to oversee the construction and be in charge when it opened. The CSU was back on track. Despite COVID and the sad fact that the head architect had died. Now the main challenge was approval by the State Board of Human Services. And within that time frame, there were 16 arduous hurdles to get over. And then a final in-person presentation down in Springfield. Well, the board was so impressed with the preliminary plan and the documentation, they waived that in-person last step. So the permit was granted. And it was last year, about this time, June 21st of 21, FRVI was part of a beautiful groundbreaking ceremony. And more recently, some of us have had the honor of touring with Rich Rohr himself. And we've always come away from these tours just absolutely awestruck with unbridled enthusiasm. We anxiously await the grand opening very soon.
Thank you, Ann. Excellent to speak. Here are the other 16 steps. We've got some time after we're done and we don't have anything to do. We'll go through them all. I'm sure they're all awesome. Next up will be Mr. Edward Manning. He's a member organization of the St. Charles Episcopal Church. He'll be giving us the first half of his presentation on what is the CSU unit that is happening over there. Yeah, podium is yours.
Good afternoon, everyone. Thank you for coming both live and virtually. We're really glad and happy that you're here today. First off, I want to thank a couple people. I want to thank Lori Baker and the entire staff at the Association for Individual Development for hosting this. We'd all be out in a hot parking lot somewhere if it wasn't for Lori. Thank you. Also, I want to thank Amita. They've changed their name so many times that we're going to slip back and forth into different names. But Ascension, Amita, Mercy, thank them for giving us the information to share with you today. Richard Rohr, the CEO, had planned to visit with us. He had some family obligations that came up, so he can't be here. I'm going to be a little bit redundant, so I'll try to be quick because a lot of these points have been spoken to already. In organizing, we often talk about the world as it is and the world as it should be. And the world as it is in the current state of mental health care crisis in Illinois is pretty bleak. As Rick talked about, when you're brought into the emergency room, first of all, you're under great stress. You're brought in by a frightened and scared family member or a loved one, or you come in the back of a police car or an ambulance. Patients that come in, both in mental health crisis and those that are not, are subjected to that chaos, the noise, the confusion. An already bad situation gets worse for the patient, for the family, and for the hospital staff and other patients. Ascension Mercy shared with us that fully 20% of the patients that are treated in the emergency room have a primary or secondary diagnosis of a psychiatric condition. Also, in the emergency department, mental health professionals are typically not on staff, and that necessitates a long wait for evaluation and treatment. The gap in services for those in behavioral mental health crisis is dangerous and creates an increase in overall health costs and an unnecessary use of resources. And guess who pays for that, folks? You and me. And believe it or not, this is not what I've heard. This is what my family has experienced in our mental health crises in our family. The world as it should be. Lori, you want to start that PowerPoint?
Mm-hmm.
We can go to about the third slide, probably. The 3 tours that we took, Ann, Rick, myself, and John Lengel, showed us the future for those in immediate mental health care crisis. The minute a patient walks in the door, no detail is spared in providing a safe, calm, de-escalating healthcare experience. 6 comfortable, quiet pods to soothe and settle a patient, as well as 2 multi-purpose rooms that can be used for decompression and provide other services. A nurse's station, you can see it on the PowerPoint right there, that faces those pods. So the people that are calming, are decompressing, are under constant watch by the staff. That's the artist rendering of the nurse's station. You can see to the left, the pods themselves, what they're going to look like. Individual pods with individual lighting, individual quiet. They've got bathrooms and showers that have doors that can be opened from inside or out. Multi-purpose rooms that have access to both the CSU and the emergency department. I said, a nursing station that faces all the patients. Rooms that can be used to triage multiple patients at the same time. And best yet, an entire staff trained in mental health treatment. All this was achieved with modern green technology and an eye toward future expansion. Lori, if you could go to that floor plan. I'm going to walk you through real quick the floor plan and talk about what it's going to provide at this new CSU. So you can't see it underneath some of the wonderful pictures there of our members. There you go. People will walk in off the street to the vestry area. The emergency room is located right above the proposed, almost built CSU. A reception desk is to the left on the plan of the vestry area. And a waiting room opens up to both the emergency department and the CSU. Down here, we have a triage room with also 2 other consulting rooms that can be used to triage as well. There are bathrooms here, and across the hall. And again, they're put together and designed for the patient's safety so that they can be accessed from inside and outside. Here are the 6 pods that are going to be used to calm people down. Divided to give privacy, yet open to family and friends who will be in the living room area right here. They can be separate, but they can also have access to their friends and loved ones. There's a laundry for the facility. And these are the 2 private rooms that I talked about a little bit that access both the CSU on the bottom and the emergency department on the top. Those can be used for a little more severe cases, or if there's an overflow from the 6 pods. utility rooms, break rooms for the staff. Also, the nurses station opens directly to the medication room, so they have all access to any medications patients might need. Multi-purpose rooms that can be used for any of these issues that come up with the staff. And then an office for the staff itself. As I said earlier, 5 separate areas of access that can be used to go from the emergency department to the CSU back and forth. Everything was designed to provide the safest environment possible for patients and staff. And we're really looking forward at the FRVI to this opening up in next month, probably. Jackie and Bill, I'll turn it back over to you.
All right, thank you, Ed. So we know what a CSU is. Why are they important? We have a couple people from some of our mental health facilities here today to give us some stories about why that is, and then a personal story or two to let you know where they can come in handy. Lori Baker, thank you.
Thanks, Jackie. I'm Lori Baker. I'm the president and CEO of the Association for Individual Development, or AID, and we have provided community mental health services since the early 1980s in the Fox River Valley area. One of our vitally important programs that we provide is also crisis intervention and services, as well as street outreach and community support teams. And we have experienced while supporting people who are actively experiencing homelessness and who are not in a recovery mode, that, as Ed pointed out earlier, that trauma of going to an emergency room can be quite deep. It can take quite a long time to be able to get services. So for us, it's very important that people have the ability to access this community CSU and stay there up to 23 hours and 59 minutes in order to be able to de-stress and de-escalate the situation, because if not, what we see happen is things continue to escalate, a crisis continues to grow, police and fire might have to intervene and force transport people to the hospital, where again, that experience in the ER is going to be bright lights and lots of noise and lots of waiting and all kinds of things that exacerbate somebody's mental health condition in the first place. It can become very life-threatening for people because it induces those anxiety, that depression, that those suicidal thoughts and tendencies, and can be a very traumatic experience. So without a CSU, people have no recourse except for to take someone to the emergency room. But at this point, with the way that the healthcare system works, that is not the best place for a person in a psychiatric traumatic crisis. Thank you.
Thank you, Lori. Next up is Sarah Gray from the Fox Valley River Initiative member group NAMI KDK.
Thank you for inviting NAMI KDK to celebrate the creation of Ascension's Amita Health CSU unit and asking me to speak today. My name is Sarah Gray, and I'm the Executive Director of the National Alliance on Mental Illness of Kane South, DeKalb, and Kendall counties. We envision a world where all people affected by mental illness live healthy, fulfilling lives, supported by a community that cares. Our mission is to provide free mental health education, support, and advocacy for individuals, family members, and communities. NAMI is the largest grassroots mental health organization in the country. I'm also a mother of someone diagnosed with mental illness. I want to stress the importance of having CSUs in our communities. For the last 6 years, each time my loved one's mental health needs escalated, I was advised by our mental health team to head to the ER. My family and I have spent countless hours in the ER when we know that our child is experiencing symptoms directly related to her mental health illness. One example this winter holiday season, my child was experiencing psychosis. It was 3 days before Christmas and the symptoms escalated throughout the day. As per her medical team, we were advised to head straight to the ER. I had dread in my heart because we were practicing social distancing due to COVID, and our beloved Mame had just passed away, my husband's grandmother and my children's great-grandmother. So we were planning a family funeral. So the last place that we wanted to be in our grief was sit in the ER and be potentially exposed to COVID. Due to the severity of the symptoms, we headed to the ER. The intake person informed us that due to the safety protocol, I should wait in the car. I was dumbfounded. My daughter was unable to communicate at this time, and I did not feel safe leaving her alone. The staff asked her a few questions and asked me, does she need an interpreter? No. And I said, my daughter speaks English. And she goes, oh, we thought she was trying to sign. My daughter had never taken sign language. And I said, the only thing I can think of is it's part of her psychosis. So we were allowed to stay and we were told to sit into the children's area because it was vacant. And we were there all night. So the ER was flooded with emergencies. It wasn't safe for her to be alone. And in some cases, it's not safe for the general public. Another example of a time that we took our daughter to the ER, where probably the ER wasn't the best option, was we were waiting in the ER, my husband and I and our daughter, and a man came in with the police, and he was so violent and in crisis at the moment that he was put in restraints and he was screaming and yelling for hours. It was really unnecessary stress for the providers, the first responders, the community members waiting for care, and the person in crisis, because obviously he was under great distress. These are two examples of when I had to wait in the ER waiting room when I believed that wasn't the best option. NAMI believes that mental health crisis response services are a vital part of any mental health system. A well-designed crisis response system includes CSUs and a living room model that may provide backup to community providers, perform outreach by connecting first-time responders to appropriate services, and improve community relations by providing reassurance that the person's needs are met in a mental health crisis. As someone that advocates for improving mental health services, I urge you to take this regionally. Funds need to be earmarked for mental health. We all have seen the importance of mental health in the pandemic. Our brothers and sisters are suffering. We are all here today because we're thrilled to have this brought to Aurora. This needs to be brought to a broader stage. Our political representatives need to hear us. We need this to be placed as high importance. We need to give tools for our community first responders and care teams so that they and the person in crisis are safe and treated with dignity. Thank you.
Okay. Sue Seckner will come and give us a personal story. Thank you, Sue.
Thank you, Jeff. Hi, I'm Susan Seckner. I'm from the First Congregational Church of Geneva and also a proud member of the Fox River Valley Initiative. I am a licensed veterinarian in the state of Illinois, practicing over 30 years. I am also bipolar, and I have had a situation where I have desperately needed a crisis stabilization unit. Back in 2004, my son, a very smart kid, very poor student, didn't turn in homework, did not pay attention in class, was basically flunking, and we were looking at sending him away to military school. My only child. Horrible situation. anytime. Big stress. So needless to say, my bipolar is very dependent on me not sleeping. I stopped sleeping. First 3 days, I called my psychiatrist and told him it was emergency, I needed help. No response, that was a Friday. Saturday came and went, no response. Sunday came, I woke up my husband in the middle of the night and said, I need to go to the hospital now. And he said, I don't know where to take you, because we've been in those situations where we've been to the emergency room, you sit, you wait. He didn't know where my current psychiatrist was stationed at. He didn't want to take me someplace else. So by the end of the next day, into the next day, I had cut off all my hair. I had burned my luggage. My husband was the devil. And he finally talked to my psychiatrist and got me admitted. I was in for 30 days. Needless to say, a crisis stabilization unit earlier in that whole process would have saved me a lot of misery. And hopefully nobody has to go through it.
Thank you, Susan. That was very, very moving. Brave and speaking up for that. Now we're going to have Mr. John Lango, who I see has been watching us. Hopefully we can get him to work on Zoom here. He's from our member organization, the Highland Avenue Church of the Brethren in Elton. And he's going to read a statement from our member organization, the Ecker Center. Is that true, Mr. Lango? Have we got a hold of you?
Have him unmute.
He needs to unmute himself.
Okay, I think, am I unmuted? Can you hear me?
Yeah, we can hear you now.
Wonderful. Well, Ed Manning asked me to read a statement from the Ecker Mental Health Center, and it consists of 2 paragraphs. The first paragraph he sent to me on Friday in black ink. I regard the first paragraph as kind of the good news part of this. The second paragraph came this morning in red ink, and it is what I would regard as the sobering paragraph. So let me share these with you. Ecker Center has secured funding to open a crisis stabilization program. The program will be located at Ecker's Community Mental Health Center's main location in Elgin and have the capacity to serve 5 individuals at any one time. The program will operate 24/7 with mental health professionals. The intended length of stay will be 23 hours or less, with the goal of resolving the immediate crisis and offering referrals, linkage, and warm handoffs to continued services that are desired and recommended. For individuals who meet medical necessity and have Medicare funding and need more time to stabilize or adjust to new medications, we intend to utilize any open beds in our crisis residential program as a potential transfer for an additional 1 to 3 weeks if needed. The crisis stabilization program may also serve as an opportunity for individuals seen in local emergency rooms who do not meet criteria for hospitalization, yet need more support than being handed a referral or discharge instructions. We are hoping to address a longstanding gap in care for the community that has been expressed by providers and emergency service and law enforcement personnel. We are having conversations and hope to partner with local hospitals for any medical clearance needs our program may have associated with highly intoxicated individuals or otherwise medically unstable individuals that may be present. We have hired a manager for the program who is set to start in late June and will then begin the hiring of mental health professionals. Paragraph number 2, the sobering paragraph. The Ecker Center has received a grant to open their living room CSU, which is different than what Ascension has done. But grants come and go. What is available today, especially in the wake of government funding due to the COVID-19 pandemic, may not exist in the future. Ecker will need a steady stream of income to continue services at the effective level they have planned. That is why the work of the regional Metro IAF to raise the Medicare reimbursement rate for non-surgical hospital CSUs is critical to Ecker's efforts.
Thank you. Ed, we'd like you to come up to do the second part of your presentation. You're here almost as much as the hosts are here.
Thank you, Jackie. So why is this important regionally? Along with gun safety, technology, and affordable housing, the local Metro IAF is addressing mental health crisis treatment. Today, people who are suffering a mental health crisis, our friends, our family, and our neighbors, enter a broken, punishing, uncaring system, one that is costly and inefficient. What we in the Metro IAF envision is this: a statewide effort to encourage and fund CSUs in whatever form they may take. CSUs are effective at providing suicide prevention services, addressing behavioral health treatment, diverting individuals from entering a higher level of care, and addressing the distress experienced evident in a behavioral health crisis. Individuals are treated with dignity and respect, and most importantly, then get linked to community-based services. What's the Metro IAF strategy to accomplish this? We will continue to put pressure on the Department of Health and Family Services and the Office of Medicaid Information to increase the reimbursement rate for non-surgical hospital CSUs, like the Ecker Center, and to standardize their rules for such units to operate. As was stated a little bit earlier, immediately following his election, the Metro IAF met with Governor Jay Pritzker, petitioned him to raise the Medicaid reimbursement rate for surgical hospital CSUs, get Ascension Mercy. He agreed the need was there, and at his behest, the rate was increased tenfold from $80 a day to $800. We believe the rate for non-surgical hospital CSUs deserves the same attention so that our members, like the Ecker Center, can open their CSU knowing that future funding will be there. The Metro IAF will meet on July 17th to once again push for funding for housing, mental health treatment, and gun safety. We will be part of the 2,500 Metro IAF leaders and friends who meet in person to urge our governor and our other state officials to expand and fund the options for behavioral health crisis care, from community-based behavioral health, outpatient care, and inpatient care to various community alternatives, benefiting individuals in crisis as well as the community at large. Just as the CSU at Mercy is the result of a collaboration between community partners, philanthropists, the Ascension Illinois Foundation's senior leaders, first responders, and behavioral health experts, so too should be the state's approach to this issue. We hope that you'll join us at the House of Hope on July 17th as we celebrate the Metro IAF's achievements in housing, behavioral health, and gun safety, and as we make and seek further commitments from our friends and officials to continue and build upon the initiatives we have already accomplished. We hope to see you there.
Hello, wow, that's a lot. Right now, I'd like to recognize some of our public officials that are here with us today. King County Chairperson Corinne Perro is here. And also, State Representative Anna Moeller is here virtually. Thank you both so much for coming. We appreciate all the work that you've done in helping us to achieve some of our goals. And we want to keep these relationships building so that we can continue to collaborate and make our communities stronger. All right. So back in February of 2019, Ed mentioned a meeting. That meeting, Representative Anna Moeller helped us to secure that meeting. And that's the meeting that changed the cost, the reimbursement rates, and allowed places like Ascension, Mercy's, CSU to open. So thank you for that, Anna. The new Ascension Mercy is that meeting, so we're thankful for that. But now we have another opportunity to engage Governor Pritzker. Another opportunity to bring all of these events to light. We've been reaching out to him since January, trying to engage him, trying to get a commitment for him to be at that July 17th meeting. And we haven't gotten a commitment yet. So, Representative Moeller, will you help us to secure a commitment from Governor Pritzker to join 2,500 people gathered from 100 member organizations of the Metro IAF across 4 counties? Help us to work together to further our work for mental health, for housing, and for gun violence.
Yes, hello everyone. I'm sorry I can't be with you in person, and I'm so proud of the work that you've done already to advance the establishment of CSUs all over the state and in particular in our region. And absolutely, I stand with you to do all that I can to encourage Governor Pritzker to come to your meeting on July 17th. He, you know, obviously, and I helped arrange that initial meeting, but really it was the work that you've done and your advocacy that really, you know, created the change that was needed, increasing the Medicaid reimbursement rates. But absolutely happy to work with you to bring him to the table, and I know that HFS has already been engaged, Director Eagleson and her staff, to talk about how we can increase the Medicaid reimbursement rate for the great work that the Ecker Center is doing here in Elgin and other non-surgical CSUs. So I continue to stand with you as a partner to help further your mission. So thank you all for all the incredible.
Thank you very much. We know that these issues are important to you as well. And the governor is key. So if we could do anything in addition, let us know who else we can talk to help us reach out to him as well. Thank you so much.
Well, thank you.
And we all know that listening and learning is awesome, but nothing gets done without some action. Bill?
All right, my leg just fell asleep. Let's see what happens. I'm upright. I've made it. I'm good. It's tingly though. Thank you, Representative Moeller. If you're still here, awesome. We've got a big yes that we were looking for. We're so glad we came out today to make sure we could move on an issue like this. So I'm just going to go briefly one more time to be sure everybody's clear why we're here. This is a call to action. In 2019, the newly elected mayor of Chicago, Lori Lightfoot, attended an action hosted by the United Power for Action and Justice an affiliate of the Metro IAF. With over 1,000 people in attendance, we demonstrated a unified purpose and will. Now, as a result of that gathering, the first stage of 1,000 homes for Lawndale is well underway. Likewise, the 4 members of the Metro IAF in Northern Illinois, of which the Fox River Valley Initiative is a proud member, are united together behind our action to be held this July 17th at 4 p.m. at the House of Hope in Chicago. A first step would be to add that afternoon of July 17th to your calendar and make it a point to be there. Our call to you today is to go back to your institutions, your workplaces, and your communities and share our excitement and enthusiasm while we try and turn out 250 Fox River Valley Initiative members and friends to attend the July gathering. Please bring 10 of your friends to be with you there. If you bring them, we will supply buses. Let's get back to our leadership by July 1st with good news for the successful proposed turnout. The flyer is available on the door. Please do not go home empty-handed. Take a flyer with you. I hate to think we wasted those. That's not good. All right, and now I'd like to introduce the chaplain, John Sale of the Ascension Mercy for our closing prayer.
Bill, before you do that,
Yes,
can
sir.
I just make one comment?
One comment from the floor.
Thank you. Back in 2009, 2010, when the mental health team first started gathering to have conversations about changing mental health care in Illinois, one of the things that we talked about was the stigma. We have had 2 very courageous statements today that break that stigma. Mental health, mental illness is just like any other illness.
That's right.
And has to be treated.
Thank you very much, Rick, for helping clarify and elevate this wonderful news. Mr. Sale, request.
What a privilege to be here this afternoon. I had planned on just being an attendee today at the invitation of Larry Davidson. And my church that I attend is St. Mark's and Geneva as well. And then was invited to give the closing prayer today. I'm the lead chaplain at Ascension Mercy. To Katie. Sarah. Sarah, how can I forget? I have a daughter named Sarah. And Susan. I can't tell you, it was 1912 that the Sisters of Mercy began their ministry here in Aurora. And their focus was to people who were needy. Long before it was ever popular to minister to those who had mental health issues. That's how this hospital was started 110 years ago. It has remained a passion. It's had its ebbs and flows. I want you to know that Richard Rohr, friend, CEO of Mercy, is leading this hospital with a passion for this community, to serve this community in every way possible, and particularly to those who have the kinds of needs that are often forgotten about. And your story, Sarah, as the lead chaplain, oftentimes I go through the hallway of the ER, and there are patients in the hallway, patients who have sitters, patients who are there for other treatments who are made uncomfortable because of someone who is having particular struggles. But I can't tell you what a wonderful thing the CSU is. It's absolutely beautiful. Thank you for your passion to help see this through. And these pictures absolutely do not do it justice. They do not. And hopefully, it's waiting, there's a few pieces of furniture that it's just delaying the opening. But it's ready to go. And it will have its own staff. And the hospital is so excited about this. Everybody is. And so I'm here as a personal witness and testimony to that. And one of the things that can I just say one more thing? One of the other things that has happened since my coming to Ascension was we began to see the value of having spiritual care involved with mental health. Funding's always a problem. So I began to become a squeaky wheel. And just 2 months ago, we hired our first part-time chaplain that is fully devoted to our mental health hospital. It's funded not by spiritual care, but it's funded by the hospital.
All right.
Because they've seen the value and they care that we minister to the whole person. So may God bless you. May He fill you with wisdom and grace and clarity, understanding, and most of all, courage to be able to serve those who are needy, those who are hurting, for the glory of God, for the good of others. For it's in His name we pray. Amen.
Amen.
Thank you, Chaplain Stale. It's a bit of a hard act to follow. I am the last presentation of the day before we get to go to recess for the rest of the summer. So I want to remind everyone that while we came here today to celebrate the creation of a desperately needed crisis stabilization unit, something we hope that will become a beacon and a model for all of Illinois, we're also here to celebrate the triumph of action over inaction. This is an astonishingly concrete example of caring and compassion over cynicism. Through our actions, by our organizing, we have resisted the sense of helplessness. We are here today to celebrate. Not just an example of what organized power can do, but to celebrate this demonstration that our efforts, in fact, do have value, and invite others to join us, and to join us in this work of love and passion and power over inaction and cynicism. And because we wish to spread our power and not concentrate our power, we need people. We need you. We celebrate today, but know that we will still lack adequate mental health care. We still need more housing that is affordable, and there's still way too many deaths from gun violence. We hope this assembly and celebration will inspire you to want to increase your capacity, our capacity as a whole, through the Fox River Valley Initiative. This is not done through social media or flyers, but by meeting face to face with others. Showing up matters. And on behalf of our Fox River Valley Initiative, I want to thank you for showing up and coming out today. Please sign up and come with us to the House of Hope on July 17th. I hope to see you there.
There will be a short evaluation